Good morning, everyone. I think we're tuning in. Oh my gosh, you guys, I'm so excited. There's so many people joining in today. This is fabulous. And I know it's because we have an awesome guest with us and a very, very important subject line. So thank you for taking the time. So I think we're just going to give it a few more seconds and then get rolling. Meanwhile, what do you think of the new do? I'm sporting a new do. It's called COVID do. So I decided it was just not going to get it cut for a while, just going to let it grow and curl. So that's my new way of feeling well, other than the fact that I have to get my nails done. All the women out there will probably fully appreciate this, but maybe this is the new summer look. That's okay too. So, all right, I think we're ready, Colton. I'm going to introduce Colton first because I always seem to forget him, and then I'm like, oh my gosh, there's Colton. He's the guy that's running the show. So Colton Wiegers, board chair to the Chamber of Commerce.
Not chair.
Or board member. God, in my brain as a mother, I'd want to think him as the board chair. So that's maybe why I'm thinking, because Sylvia Martini is going to be coming to join us in a couple of weeks. So we'll introduce her and a few other guests that we've got lined up for our future shows. So thank you for joining in. It's Deb Wiegers, Wiegers Financial and Benefits. And this is our 9th edition of Thursday Live. So it's been quite a run. We've had some really good uptake and some really good subject lines. I always suggest, you know what, if there's someone out there that has a subject line or a speaker that would want to join me in one of my sessions, I'd be more than happy to talk. So with that said, we do have two for the next following weeks. We have Sylvia Martini again for next week, Thursday, and she's the interim CEO of the Greater Chamber of Commerce. So it's going to be exciting to hear what she's got to see, what she's seeing out in the marketplace, and couldn't have gotten a better person to step up to the plate than Sylvia. So we're looking really forward to having her as my guest. Following that, I kind of had to do a little arm twisting. We do hope to have a couple of insurer perspectives. So with all the things that we talk about in the insurance level, I mean, we've got some fabulous insurance companies that work with us and have been very, very gracious in doing all they can to help out their clients by deferring premium renewals and deferring premiums, extending benefits to those who are laid off. It's everything that they can do to make sure that we do as we can best as an employer to make sure those benefits stay in place for them. And that said, I'm going to be introducing Mike Kars from Blue Cross. He's going to be my guest in 2 weeks. So want to get into the mindset of the insurance side of things and see what they've got to say. On the insurance side of things, noteworthies. Do know that for some of you out there, when you are looking at the employees that you've laid off, there has been an extended period of time. So anywhere from 60 to 120 days or 2 to 4 months is what you were able to extend your disability benefits to the employees that were laid off. Do know that some of your carriers out there, your insurance companies out there, are now coming to a close on their 60-day. So do look at that. If you've laid off employees, you need to be rethinking how you're going to go back and communicate. Well, now it's in place if these employees are still on the laid off level. The other thing that's come up that's quite interesting from our perspective in dealing with our clients in the administrative side of things is the team at Benefits is coming up with all sorts of interesting scenarios now through these COVID times. One thing you need to keep in mind, if now, because we can go back and get elective surgery, what you need to keep in mind is now what we're being told is that there is going to be a quarantine period before you can get the elective surgery done. So the quarantine period, which is the 14 days, of course, it will not be covered through the insurance company. So you just need to have these conversations with your medical practitioners and then just be thinking and planning what you're going to do at the home front if you want to obviously keep for safety of yourself and the family. So again, the elective surgery, there will not be any benefits paid on that quarantine period before. My guess is I think, and now I can't recall, but it might be following, of course, and you'd want to anyway. Phase 2 is opening. We've got a lot of businesses out there. I do want to just do a shout out to all those that are really pushing through all this. It's been quite the journey for them. I do encourage you, be kind and be understanding of these businesses that are opening. These things that they need to do is certainly not within their control, and it certainly becomes part to stress for them, and certainly on their bottom line, they're what they can bring in as revenue. Would they like to do more? Of course they would, but they're trying to keep the safety of you as a consumer out there. And I'm really excited to say, because we have many clients that are in that hospitality field, hotels, restaurants, in the tourist side of things. And my heart goes out to them because they're getting the biggest hit when it comes to all this stuff that's going on with COVID. And I know the government has come out and they've given a subsidy to them, which is good to see. It's a $1 billion relief so that we can now move and still keep in place some of those seasonal types of things that we've got going on. So that's good to know. But interesting stat, and I guess that's why I feel for them, is that they say that they revealed that 42% of businesses in the accommodation and the food sectors are going through the tougher times compared to 26% of other businesses. And they're reporting that their revenue losses are much, much greater because we cannot go into any large events for the next few months. So again, be kind, be gracious, and be supportive of them as well. Colton, how much? I want to really touch on mental health. We got a couple minutes? Sorry, 11:15? Oh, got some time. Sorry. Kate, I really want to just touch on mental health a little bit because it's a big, big part of what we do on the insurance side of things. One of our goals always when working with companies is working towards that organizational well-being, working towards a healthier bottom line on every level. And mental health always has been top of mind. And it is a little bit more obviously because of COVID. So interesting stat again, just to keep us mindful, is that Deloitte came out with a study and they have, I believe, hadn't touched on where COVID was even really going when it came to the mental health space. They're indicating that there's going to be $50 billion lost to mental health in Canada. And that number sneaks up to 56 billion because we need to think of those indirect costs. And that's why I say to you as the business owner and working towards, trying to keep your workplace mentally healthy, we got to think about what it does and what we need to be doing as it relates to healthcare costs, income replacement, if they need to be taking time to get better, absenteeism, presenteeism, very, very huge. We talk about this lots when we talk about the things that we work with and at our organization beyond the benefit side of things. Employee turnover. So again, be thinking of that. Mental health is huge on the business side of things. They are projecting that in 2041, I know that seems like a long ways away, but it really isn't. If we don't get a handle on this and start to really tackle it, and we can do this, we can push through this, we expect that those numbers could rise into the trillion. So it's important that we really grab this thing, and it doesn't have to be overly complicated. We can just think simple steps. One of the things that I want to say and encourage by Bell Canada, with all the work they've done on the awareness side of things, they said that the utilization or the reach out to get the help and the care is grown by 190%. So it tells us this is working. And so for those who have or are considering employee assistance programs, utilize the opportunities that are within your own community, but there is a very important need for those programs to be in place, and so we're really excited to be able to offer that. They say that it's a 4-to-1 return. If we can really do a good job in providing that safety net, there is a return. So on the business side of things, it does make good business sense. Absolutely. So my little thing, because it doesn't have to be big, my little thing is that what I like is I'm really growing towards like podcasts. And I want to say before I introduce Brynn, our guest, is that the podcast I've been listening to a little bit of everything, but the one that really kind of resonated today because of the subject line was, and they're like 8 to 10 minutes. His name is Rob Dial, and he has the Mindset Mentor. And you really got to check him out. It's really good information. The one I really liked, how to change your anxiety to excitement. And there is scientific evidence, he says, that there is what we would call to realign anxiety reappraisal. You got to go find it. You got to listen to it. It's going to take 10 minutes of your time. Honest, you'll start playing around in the other ones. I think it really helped me in that mental health space. So anyways, all that said, I need to move on to the more important subject line of the day. Miss Brynn Boback. Is she live? Brynn.
Hi there.
How are you?
I'm doing really well, thank you. I'm
Good.
up at the lake right now where it's raining and it's cold, but we're able to do this through great IT, so grateful to be in the quiet.
And you know what Cliff always says? Any day at the lake is a great day at the lake.
True enough.
So, talk about mental health space. The best part is going at the end of the day, sitting outside and listening to all the elements out there, the wind, the trees, the water. So I'm jealous, but that's what I'm going on this weekend. So, All right, Brynn and I go back a long ways. Oh my gosh, I still remember the cold calling days in my business, and that's how we met each other. I don't know if I should say, I'll say many years ago, Brynn. I won't tell
Few
them.
years, few years.
Few years ago, and we really just watched each other grow over the years in business and personally, and I was really excited to be able to reconnect with her when I came across, and again, things just happened for a reason, was asked to do a little bit of volunteer work with the Children's Hospital Foundation. Back then, I'm just trying to think what it was called. It's gone through a few name changes, Brynn. It wasn't the
It's
disease
gone
discovery.
for, yeah, it was four name change. Yep.
Yeah. Now we talk about perseverance, and I call it tenacity or prenacity. Brynn is that gal that's got it all. So I just remember the beginning days when we, or really you had already broken ground, and I was thinking when I got involved, you guys had already been really kind of pushing through a lot of real big barriers, and so I mean I appreciate that. Obviously, what you've done has brought us what we've got today, so that's fantastic. I always remember Greg Ewell. He was a little bit worried about us being on the board together. The two feisty women on the board, it maybe worried him. We're talking Jim Ewell, and he can handle anything. But that said, flash forward, here we are. Oh my gosh! So Brynn has been with this project and this foundation from the the early beginnings, the beginning. So president and CEO, now called the Jim Pattison Children's Hospital, and the foundation's been in place since 1999. Brynn, I tell you, I just thank you for all the things that you've done. I mean, you've represented yourself extremely well on all different levels in terms of a volunteer. You've been a big advocate and a fundraiser. We well know that. You've created some good relationships. A graduate, which were always nice, the University of Saskatchewan. But boy, like everything in between in terms of being on boards on not just a local level, but on a certainly the Canadian boards and advisory councils that you're part to, and SGI. So wow, where do you find the time?
We all find the time. That's the best part of Saskatchewan, because people in this industry, in your industry, business, corporations or nonprofits, we all find the time because it's our passion, and how fortunate we all are to have the opportunity to do what we love to do. So, you know, it's like everybody else who's watching out there, we find the time to do the work we want to do. And obviously this was a very big passion for myself and thousands of others in this province.
Yes, absolutely. And you know what? I think that part of, again, going forward in the mental health space, I mean, I know myself, there's going to be a lot we'll talk about it, but I know that there's a really good place on a mental level. I'm really excited that my cat, my two cats, or my foster kitties, I guess, are going to be adopted out. But that was our project over COVID, is fostering a mom and her two cats. And my daughter still is fundraising. And I see where it gives her really that level of energy and feel good. She's been doing a bottle drive. We look like, for lack of better words, we look like hillbilly. They had an awful lot of bottles in my...
all for a good cause. All for a good cause.
For an absolutely great cause. And she's excited, and people are offering to help her and get trucks and bring it. And she's got an appointment. So it's all good. So I thank you for all you've done, and all those that are listening in that are in this field. Hats off to you, because there's a tremendous amount of work, but I know you do it with passion. So that's really what we're here to talk about. So let's kind of just take the story. We talked a little bit about the pre. Maybe just kind of back it up a little bit before the pre, how 2020 was starting out for you, Brynn. I know that there was a lot of cool stuff. The hospital opened 2019. We were excited. Things were rolling. January, you had plans. Where did it go from there? And then how did it roll in, and how did it play out? And where is it at on the COVID level?
Well, I think we can all agree that COVID-19 was unanticipated and certainly not considered when we were doing strategic planning at the beginning of 2020. It was certainly a risk of this nature was not placed into our risk registers, because we were not anticipating something to be so impactful. However, saying that, once we started, our ears to the news, and started listening and seeing the progression of COVID and where it was going globally, I think first of all, our whole team, and I'm not sure how the others that are listening are feeling, but I think that we felt Saskatchewan's always been very resilient in times of challenge. We persevere, we meet those challenges, and we come together. So I think there was a little bit of denial in terms of how impactful this might be to our industry and certainly to our country and our province. But saying that, I can tell you that once the declaration of emergency was made, action was needed, and action was immediate from all of my colleagues and from the business sector, and of course from the province. So I think it just shows you that we can adapt very, very quickly, and we had to adapt quickly, and that's exactly what our foundation has had to do. You have to pivot very fast on something that's not within what you perceived as being your structural or organizational plan.
Yeah, absolutely. And when you talk about it, and I think that probably a lot of people can attest to it, when this all started to happen, I know where I was when I got the first piece of news, and it was my friend's husband who was quite concerned about whether or not we should pass through the Toronto airport. And I went, that's nothing, right? And it was then when it was starting to happen, very surreal. And then it was like, holy crap, we're in it now. Like, what's going on? It just like, right? So a lot of things reversed very quickly, right? And we talked about it, and we will talk about it. And you talk about pivoting and what you needed to do to kind of reshape yourself, and that we didn't have much time. Like, what would be a couple of those things that you had to do quickly that seem to be working for you right now?
Well, let's take a look at slide 1, if Colton could put that up on the screen for everybody, and I'll just quickly walk through that if he happens to have it.
Can you put that screen up or that slide up?
What?
Can you put the slide up?
Oh, yeah.
Sorry. He's listening to you.
Okay, that's all right. We'll go to the next screen.
One moment.
Thank you.
You know, I think one of the things that probably made us feel like this wasn't going to, I don't know, for me personally, I always remember when Trump said, by April, we're going to be back in business. And I just thought, wow, okay, we're just like in this little mini dream. And that didn't quite happen the way we wanted it to be, right? So anyways, your slide's on.
All right. Well, first of all, this just kind of gives a little bit of an overview of how things happened. And I just want to say that while we rely on communities, the communities need us, and we are, everything is interrelated, it's connected. There is a need for foundations and organizations and nonprofits because we fill a huge gap in our community's needs. And I think once COVID really hit, you started to see, as I've indicated on the slide, that perfect storm on our investments, and any of our foundations or organizations that have funds endowed or not, there was some very strong fear about the performance of those investments. And then, of course, the confinement measure requirements that went in place immediately. Foundations had to cancel events or functions, and they had to ensure that they could shift quickly and reach out to their donors quickly to communicate, as well as to see if there was any way to transfer that type of event donor opportunity to perhaps a different type of funding. And then, of course, we found out that you can't go and meet person to person, face to face, which is what we're all about as nonprofits. It's a relationship building industry, and that became very, very challenging. And then, of course, donors, being unable to meet them and trying to contact them virtually or via telephone was required. But they too were also responding to their economical crisis. And so we had to be respectful of that. It just shows that the foundations and our nonprofit industry will be impacted from these particular issues. And there's going to have to be a way to find new opportunities to take these effects and turn them into new opportunities. So the other effects that I've just put down here for people to take a peek at is that while our actual operations are being impacted, so are our people, our team's health and their availability, the anticipation and the worry of the reduction of your revenue streams, particularly in non-designated areas, and the concern again of the reduction of our capability to finance our projected areas that we like to support or that we're expected to support. As well, we all know nationally there is going to be a probability of a recession prolonging this crisis. So the impacts that we're feeling today and the decisions that we're making today are going to have a long-term ripple effect. And lastly, nobody has a crystal ball. We're in uncharted waters, but we do need to plan for those. And sometimes you plan for the worst and you hope for the best, but on the upside of it, I do believe that there will be silver linings and that the donors and the people that are loyal to our organizations, if we reach out correctly and we do our communications well, I do believe that they'll be there to support us in the future. But this just gives a kind of a rundown of what happened and some of the impact that I believe our organizations are all feeling today.
Yeah. No, and those are great points, Brynn. And I think, you know what, as any business would do, which you are a business, is you have to kind of take the realist perspective. You have to sit down and you say, all right, guys, we can all just wish this over, but we need to figure out what the next few months and years are going to look like. And then that's going to be the basis of how we're going to plan going forward, right? So I know I talked to a good friend from the Heart and Stroke Foundation and Dale, and I know you and I talked, Brynn, about some of the layoffs and the changes and the reduction in hours on your team. And that, again, that goes across all the foundations and the nonprofits. And, to try and do everything that you would want and wish to do and only be at, 40 or 50% of capacity to do it has got to be incredibly difficult. And again, because you guys are very passionate in your field, I don't think these people are going to slow down. The ones that are still there, from what I know Dale had mentioned, is like, and I know you mentioned, we're working harder. We're working harder because we need to be doing what we need to be doing. We promise this, and we'll do our absolute best to get there. Are you sensing that when you're with your team and you guys talk? You kind of got people that aren't able to do what they'd like to do, but you got the people there that are doing it. But how do you manage through all that?
Well, I think you have to be very flexible. And the one thing that the transformation that we saw was pretty seamless. And I think the reason for that is that we were in a position where IT had been invested in. And for those that are on the call I'm watching today, I can't stress enough how important that was in our transition. It really came down to ensuring that we had the right IT platforms available, and we had been utilizing those for a while. And we every year take inventory of where our technology platforms are, so that we can see if there's something that we could use, or we can see how we can become more efficient in using them. So we are real believers in utilizing new technology as well as professional development, and ensuring that our staff and our teams are all very well educated in those areas. I have to say, mind you, that the education part for me has been quite new in terms of all of the different platforms we're using to be able to communicate better with our donors and our stakeholders and our patients and our families and those that we serve. It's been an interesting and quick learning curve, but I'm very grateful that we have invested in IT, and I think that that's going to be something that the majority of our organizations are going to have to give some consideration to as we move forward, because this COVID-19 pandemic has given us a chance to really take stock of what we do well and the things that we need to improve on. One thing I do want to say is that in a crisis management plan, you learn about the capabilities and your strengths and weaknesses, of course. You also learn about the people that work with you. And I would suggest that all of you are nodding when you say you've got some amazing, dedicated, committed employees and staff people that have really helped and come to the plate to help you achieve things that you didn't think were even possible. The charitable sector is always going to be required. With great respect to the frontline workers today and what they've been doing in the last several months, I'm going to suggest that our community foundations, our local foundations and organizations, our nonprofits, we will become next in line as frontline workers to our communities after this is over.
Yeah.
We will be needed, and I think it's really important that we keep our relevance and the communication open, as well as be very, very clear on what our messaging is, over the next couple of months. You know, you look back, I look at Saskatchewan, and where do people go when they need new ice in their curling rinks, or they need a new hockey surface, or, you know, they need something within a new playground structure. They look at organizations or small committees of people to fundraise. And whether you're a small, medium, or large organization,
Yeah.
those things will never get lost in COVID-19. Never. We are relevant, and we are very, very vital to the spirit and to the capability to grow our communities, whether it's locally, provincially, or nationally. So I think our relevance today is the day, and moving forward, to show your stakeholders, thank your stakeholders, and tell your stakeholders how important it's going to be for post-COVID. And as you ask, and I don't think we should be afraid to ask. We just need to be sensitive when we ask, as opposed to being really aggressive. We can be very truthful. Here's what we do with your dollars, and here's why we need them. So
Yeah.
COVID will give us new opportunities. To that point, we've seen new partnerships form. We've seen national partnerships in the Frontline Hospital Fund, and you can see by the chart there, whether it's local, provincial, or national, there are several ways for our organizations now to work together in ways that we never anticipated. We can get involved with one another where it's practical, where it makes sense, and where we can actually fill in some of those financial gaps that we will experience. It's not even a may experience, we will experience those. So I encourage those and my colleagues that are on the call, consider partnerships that would work for you, your community, your organizations. That makes sense. Because together we are stronger.
Yeah, absolutely. And I think, Brynn, is there a question, Colton?
Yes.
We're gonna pause, and I want to talk about that. There's a couple. You brought some really key points, so we'll just grab the question.
So I'll jump in quick, Brynn. Guylene's asking, will people be able to receive a copy of the slide? Will we be able to circulate that to some of the people?
Absolutely, I'd be happy to share the slides.
Okay.
We'll post some contact information in the comments, and as well too, if you registered directly with us, you can reach us directly and we'll get that information to you. And I'll make sure to put them on the big screen when Brynn's talking about them as well. So we'll make sure you don't miss anything once she gets around to that topic.
Perfect. Thanks, Colton. Sorry, Brynn. Let's kind of just catch up, and I'm going to end on partnerships because we had a really good chat about that yesterday. You talk about what's happening now and the keenness or the keen awareness that you needed to do to retool. I call it that. I mean, I think everything's become crystal clear, or as crystal clear as we're going to get it for the next while, because nothing's ever perfect. But it's to be thinking about now, what do we need to do? I mean, this is where kind of like that survival mode is kicked in. And oh my God, I laughed when you talked about the technology, because you don't even want to know how my day went yesterday. It was like, so I get it, but I'm so proud of myself when I'm learning these things, and people are very patient when they're training me. My poor IT guy, I think I was going to have like my heartbeat was just racing, and he says, like, take a breath, Deb, it'll be okay. So there's many of you listening. I know you're feeling this. You know it. So you know what? Don't be scared to fail. Do remember how to save a document, though. That would be very important. And we have to we have to learn this stuff. So quick learning curve, very important. Keenly looking at the business. Absolutely. Like, you guys have always been, spectacular at your efforts and how you go about raising money, and many other foundations in the city and nonprofits. And you know what you need to do. You probably never thought you'd have to step it up a notch with 3 to say, but what more can we do? How much better can we make this? And the community out there is going to, have to be able to be there to support you. And when you talk about those partnerships, Share a little bit. Like, I know one partnership that to me was very cool was when, with RUH and West Cap and Jim Pattison Children's Hospital, we would talk about one of the bigger things in the mental health space is that isolation. And what you guys were able to do collaboratively together to bring that back to the community. Oh my gosh, the children in the hospital were probably in tears, and the grandmothers and grandparents had to been ecstatic about that.
So that partnership actually is inclusive of St. Paul's Hospital Foundation, Saskatoon City Hospital Foundation, Royal University Hospital Foundation, and Jim Pattison Children's Hospital Foundation. And it was a collective effort to try to mitigate some of the risks with COVID-19, as well as achieve some additional new funding so that we could meet in real time immediate needs for our front care line workers. And I know to the other foundations that have taken on those in their local communities, incredible work, because the attention and the quick action of our colleagues across this province have given back to their communities on those frontline worker locations and facilities the opportunity to do their work better and to serve our patients better, in our case, healthcare. But there have been many organizations that have stepped up to the plate in different ways and received new and innovative funding so that they can achieve more within their communities, so that people are tested more quickly and people are receiving their protective gear quickly, and that there's opportunities like iPads and connectivity that is needed when you're isolated. So yes, all of those things were done on a very quick timeline, and I can tell you critical to the ability for us to deliver better care or better services to those we serve as nonprofits. It's been an amazing partnership, and that's a perfect example of when people come together and they have an idea, they share it, and they go, we can do this stronger, we can do this better, we can communicate, as opposed to fragmenting every single time. I have to say, you have to find your voice when there's a time of crisis, because many people and many organizations on this call today are looking for those dollars and require those dollars to serve their clientele, their base. And we need to find our message, and we need to be very clear with it. I think communications is one of the key pieces we're going to take away from this, in knowing how to effectively do it better, how to find the voice, because the services of nonprofits, they don't pause. They don't take a break. They are not postponed. They are not canceled. Events are. Your fundraising streams are impacted, but the needs will never go away. So what we have found is, really the summary is, you do need a new action plan. You've got to look at your old strategic plan, take a peek at it, but you're going to have to pivot and change. It's got to be fluid. You'll have to look at internal crisis management. What does that mean to your staff? What does that mean to your teams within? And we talk every single week to our teams. We ask them the questions. We don't just say, this is how we're going to do it and implement. We ask for their advice, their suggestions, as well as, how are you doing? What is the well-being, and to the mental health piece? We're going to all be impacted by this. So it's really important to pay attention to those you work with and work around. The other one is taking appropriate HR measures. The HR measures are going to be different in every single case. Some people have small, medium, and large employee bases, but there will be impact to certain things you can or should or may want to implement with the feedback of your teams. And the IT access, it's going to take shape that internally you might be okay today, but now you have to look at virtual and external. And the boards that you report to, they have to be convinced a little bit, but I'd say after COVID, they're probably much in the same place in understanding that your investment in your IT software and your PD, ensuring that you can use it efficiently, is going to be a key player as we come out of COVID. Your communication, as I mentioned, is absolutely necessary, that your message is clear, it's consistent, and you can share best practices. Don't reinvent the wheel. If you have opportunities with partners that you can say, what did you do here? Or how did you do that event virtually?
Yeah.
I haven't met anybody that won't share those things, because we're all doing great work together, and we're all doing well independent. We're still doing some great work. So share those opportunities where you can. And then, of course, reaching out to your donors and your stakeholders and those you serve is very important, whether it's on a personal level or you decide to do it more broad and you have newsletters, virtual newsletters, or information pieces going out. People like to be kept in touch with, and they also like to know what's going on. They'll also want to know where you're using the money and where you're needing money. So don't be afraid to communicate.
Yes, exactly.
And of course, I would be remiss if I didn't bring together one of the key issues, and your financial, your budgets. We're asking for, your budgets are going to change. Your budget will have to be this year and going forward fairly fluid, using projections as best as possible, but realizing nobody has a crystal ball in knowing what your actual impact is going to be come 4, 6, 8, 10, 12 months down the road. I believe we'll see it in the next few months, but I don't believe that will be the final indicator. I think we're going to continue to see a ripple effect. The economy has been compromised, and it's been because we've been, and I compliment our government and our medical system for keeping us safe, because if you do look at our numbers, we're quite low compared to other provinces. So very, very appreciative of that. But our economic numbers are going to take a real hard hit, and that will, of course, impact the foundation. So, I would appeal to your boards to be patient and to have projections, but to ensure that there is an opportunity for some fluidity as you go through your year. And shifting prioritization. Shifting your priorities is going to be important, just like your budgets will show you. You may have thought you could do something this year and may have to wait. That doesn't mean it won't happen. It just means you need to shift your priorities with what you can achieve during this very unprecedented time. And lastly, you need to stay optimistic. There's going to be silver linings out of this. There are going to be new opportunities out of this. There are going to be new partnerships made. There are going to be different ways of doing our work, but I truly believe that we're going to find a very, very good thing come out of all of these challenges that we've had to go through in the last few months. And if you think about it, I was thinking about this last night, it's been 9 weeks, 10 weeks.
I know.
And the shift has been so immense. Yeah. And while it's a blink in our lifetime's eye, this will have a huge impact. So we do need to change the way we think, the way we work, and our expectations.
Yeah, absolutely. Well, and and when we talk about, just like the community in itself, I'm thinking as you're talking, and I thought one of the things that popped into my head is that, yes, I mean, through all these things that are very important, obviously the real thing becomes that bottom line, that budget and the real dollars. And, maybe because and I love the way you say it. I mean, our economy has been compromised. We've been compromised because that's what it is, right? And so then we have to just work with that. And if it means that someone would normally have maybe written a check, for example, of X dollars every year, I mean, you still want and hope that will continue. But if it can't be, because with the compromising of their business, they're not able to, for example, there's other ways in which you can still bring that volunteerism and that support back to it. Mm-hmm. And I think about all the expertise and the professionals out there for everything that you maybe need to pay for. Maybe that could be gifted, right? So, So how can we indirectly help that bottom line to the community, saying, you know what, rather than you having to, because you need the expertise of these things, whether it's an accountant, a lawyer, anything else, but maybe that's where the exchange of that volunteerism comes into play. As we're going through right now, the moment right now, we've got to pivot. We've got to be thinking about what we can be doing differently and still more effectively. And we're going to get through this. And to your point, your dollars raised. The events of this year are done, as much as all the social events are done. And so we need to be mindful of that. So the community, the people on the other end of what the work you people do is still incredibly important. So how can we still reach and manage and still support and lift and keep this thing going? So it's very much what we practice all the time, Brynn, and I think that's why I really like the idea of getting together with you and chatting, because some of the things that we talk about all the time will resonate with us, and we talk about, you know, our organization and the expertise that we have and what we need to do to help our clients. We talk about, you know, those support systems that we need to put in place to help support our clients, whether it's the partnerships we have. You mentioned HR. I mean, absolutely critically important, especially in this moment of time.
Mm-hmm.
And then we talk about, you know, like the community. And I think about that. That's what we are all about. That's what you're all about. So do you have anything that you'd want to add to the chart? Like, is that, I know that we've talked about a few things, and I really love that last document that you provided us.
Well, I think it comes down to revisiting our values and our purpose, and being very, very honest with ourselves as to what we can deliver over the next little bit. And people are always calling this the new normal. I'm just calling it the next normal, because it's going to be the next normal. I think that we just also should take a moment to realize the little things that we've always taken for granted, like the people in our lives. That economic environment, I'll just pivot on this one. If you
do you want to take this up or down, Brynn? Do you want to?
No, that's fine. We can talk about this right now. This just shows to our colleagues on the line as well that are watching. This just was what I actually provided this to my board of directors last week at our board meeting. And what this shows you is phases 1, 2, and 3, and they call it the new normal. I'm calling it the next normal. But it gives you a graph and a baseline as to what is being predicted for fundraising and when it will start to return to a normal. And we will share these slides with you. This is more of an informative slide, but I think it helps to for all of us to understand we're in this boat together, that this is systemic of COVID-19, and it's going to impact us all in different ways. But this is just something that when I looked at that particular chart, went, yeah, we're going to have to change a few things, and we're going to have to make some adjustments in the way we deliver our key messages so that we can help our curve start to go up and meet our objectives, because otherwise we don't want to fall too below the anticipated annual revenues that we need to continue and be sustainable.
Yeah, no, I agree. And you know, I agree with you. The new normal, I don't know if I like that word either. I like the normal. I mean, it's the now normal. This is the now. Let's just do what we need to do now. And, you know, we've used this word pivot and adapt a lot, not just today, but we use it many, many conversations that we have. And it should be kind of like our mantra, like in terms of how we got to just make our go forward happen, right? So I know that, you know, you mentioned the government, and I know they've been very supportive of the community in general. Is there anything that you feel that the government should be doing differently to support foundations like yourself, Brynn?
Oh, I think the government has a lot on their plate right now with keeping people safe. I would consider that what we do is going to be up to us at this particular time. I think that what they're trying to do is ensure that we can reopen an economy that has been, again, compromised, and keep people safe doing it, and making sure that Saskatchewan in their reopening is efficient and effective. I think that what we do need is just the recognition to nonprofits that we are valued, that we are important to our communities and to our province. But in terms of any other help, I can tell you that there are a number of areas you can find help. And I do believe that there is a slide that we've shown that indicates some of those areas where you can get support. And we've got a local and a provincial as well as a government slide. There we go. And those opportunities are available to all of our nonprofits. And you know, in our case, we've applied to a few of the community foundations, and we will be applying provincially and nationally for support to help us with some of the HR resources that we require and some of the emergency community support funds that are available through the federal government. So I think that those opportunities should be looked at, and I would, if you haven't already, I would look into them. Most of us are able to apply for maybe not all, but some of these opportunities. So it's something to take a peek at and to make sure you do your homework on, because if you can help subsidize some of your lost revenue, that's going to be important for a lot of our organizations.
Yeah. And you know, I know that the dollars up front, dollars just to cover that day to day, I know those things become important. I mean, obviously to pay salaries for people to do work, that becomes important. But
yeah.
I know that, you know, I think about back in the days when we did, and I referenced it at the beginning, the Research and Discovery Center, where we really were trying to focus on, you know, those foundations are in these places, is that we still want to make sure that we're not just funding something, but we're fixing something. And the research becomes very important. I mean, if we have, you know, sick children and sick adults, we want to find cures. We want to find ways in which to manage them. We just don't want to give money, right? It has to be more meaningful. So, you know, when the government supports come into play, I think that would be an area that'd be really, I think, effective and useful amongst trying to cover off, as every other business, the day-to-day things that we need to do as well. So, so I think I got one question, unless there's other questions that you want, we're going to wrap up. I'm going to let Brynn do a little, I know she's talked a little bit about some of the things on the go forward, but we're going to kind of end on a prediction note. So if you have any questions, now's your time. And Colton, do you want to read this question?
Yeah, well, the first question here, from a comment earlier, someone gave you a shout out, Brynn, I forgot to mention that, said he was working with some of your team. I can't find it right now, but
there's many of those.
Lots of comments like that, but the question we just had is, what technology platforms have you used or looked at, and do you have any examples?
I certainly do. Let me get that for you. Good question, because there are so many. So just to give some examples, we use Razor's Edge and then the Next program. If you're not familiar with Razor's Edge, please Google these. Or if you have any added questions, I'd be happy. We could send out a little bit more information to you. Financial Edge, of course, is one that many of you may use. And of course, we're using different platforms like the GoToMeeting, Zoom, WebEx. We're using Google Docs, which has allowed our staff to go virtually and continue their work from home, as opposed to having to come back and retrieve files or retrieve information. So Google Docs has really saved us in having to go back and forth to the office. Asana, which is an online project management system, has been imperative to our ability to do good work in a very tight time frame, critical path. It's called Asana, and it is a communications tool and platform whereby you can place all of the different things from many areas of critical path management into one document, so every one of your team can see what the other is doing, and that there's a date associated, and there's metrics associated around that, so that we know when it's complete or when it's still outstanding. Of course, we had to ensure everybody had the ability for laptops, and we have a gift online program, and we also are using many other platforms in terms of how we are able to connect with our donors and our stakeholders. Don't have any issues with sending out that list to Uyghurs, and then they can place that onto this particular piece if you'd like.
Yeah, no, thank you for that. I appreciate that, because that was part of, I mean, we've been, my Phil IT guy, he's been just like our godsend, because when you talk about that whole technology piece, wow, that thing exploded really fast. And he had his hands full for a while, just on every level of training and just the new system we pushed into place on our workplace chat. And that's a shout out to Colton too, is getting, when you talk about connection with people, that our workplace has allowed us that opportunity to stay connected with our own team, because that becomes very important. and then certainly all the, like you say, all the different tools we're learning all the time, the WebExes and the, like we just, it's a constant learning curve, but it's needed. And so I know we're always willing to share what we've been doing too, because we've had to pivot very quickly.
I think that the hesitation when you go to new technology, by the way, is cost, and also the time it's going to take for people to learn it. But I can tell you that I am so grateful for the push from our finance and IT people that work within our organization, because it's given us the flexibility and the adaptability to transfer into a virtual workplace very, very quickly. Our pivoting was within 48 hours, and everybody was up and running, and it really made a huge difference. And you want to protect your staff, and you want to protect your teams and your donors and the patients we keep in contact with. So the communication platforms were really, really key to us. And while it does have investment, I do believe that this is a good investment for any organization that wants to grow.
Yeah, I agree. Do we have a question, Colton? One more question, and then we're going to wrap up?
No,
we're good. We're good. It's you know what, and I think that every organization, it's that they talk about it, and I think what the good news of all this is going to be, I believe there's a absolute silver lining. Some days we struggle to find it, but there's a silver lining in all this, and so what you do, what the community does, to keep our downtown sustainable, what the hotels do to bring our guests in from out of province. I mean, I think when you talk about that safety net and that support system and what we can do as partnerships, let's all we need to think it out of the box. It's that simple term. Mm-hmm. It's just like, how can we think out of the box? How can we do this differently? Because it's okay. And maybe if we try something and we don't make it, according to my podcast, I mean, don't be scared to fail. Some of these things we're all trying for start, and maybe it's going to work right now, but that doesn't mean we can't refine it. What's maybe that next level that we might want to go to? It's kind of baby steps. Right? So we're not going to get there overnight, especially for some, it's going to be a little bit longer of a learning curve in a lot of areas than others. But don't give up hope. You mentioned that. I mean, at the end of the day, I'm kind of excited to see what this next level of my lifetime is going to look like. It's going to look different. But so did the people that came out of the 30s. And they probably didn't expect where they'd be and what's changed on a go forward. So that is just life, right? And some days it's a bummer.
True. I guess I'd just like to end with one last slide, and I think, Colton, you've got it. And I would call this the biggest speed bump we've ever seen. There's no question. I thought the opening of the Children's Hospital was one of the biggest, but I'd say COVID has surpassed that. But underneath it, and I use this quote from Margaret Mead all the time, and I believe in it: never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has. And that's where I'd like to leave it, because I really do believe that our nonprofit sector, we are the heartbeat of our communities. We are the heartbeat of the province. We are the heartbeat of our country. And to embrace this as new opportunity, to look at changing our ways, doesn't mean it's a bad thing. It just means it's a change. And I do believe we're going to grow from this, and we are going to find some real value in coming together in times we didn't think we could, and finding new opportunities through COVID-19. I totally have faith. I've always had faith in Saskatchewan, and COVID has done nothing more than to build that faith and that hope in our organization. And I think for all of those out there that are doing incredible nonprofit work, I say congratulations to you. Keep up the great fight, and know that you're valued in your communities, because we are going to be, again, with great respect to our medical teams, the nonprofit sector will be looked upon as possibly the new frontline workers moving in the future.
Yeah, and I'm going to echo that 150%, because there's always has been a lot to be done, a lot more to do, and the passion that whole community has. It's just, it's amazing. It's like, you know, when you have one of those days, you just need to be thinking about what they're doing and what they're making a difference in this community. And it should just kind of resonate that maybe we could be thinking differently, doing more, right? So on that note, there's one last question. Trish, Trish says, thanks, Brynn. Hi, Trish.
Hi, Trish.
Yeah.
I want to thank everybody for taking the time as well. I'm honored to be here to speak. And I know that I've learned a lot from my colleagues as well. I will continue to, and keep our minds open and our hearts open. I know that we're all going to be successful, and love to hear about this a year from now and where we are a year from today.
Absolutely. Looking back, I think, you know what, someone's going to make a storybook out of this, maybe a movie. I don't know, maybe we'll have a movie, you know. So thank you. I'm going to end on that note because I think in the predictions we covered off a lot of ground and very meaningful ground. So thank you, Brynn, for taking the time to join us. And I do hope that you get out. The sun's shining over here, so I'm assuming that you're having a great day over there. It'll come to you. And so on that positive note, I want to say thank you, Brynn, for joining us. I want to say to the audience, thank you for joining in. Do remember that this is live. This is our best, I think, one of our best attended live sessions that we've had, Brynn, so hats off to you. Very important topic line. But it is going to be posted in our Facebook. So it's going to be on our website and on our Facebook. And I encourage you to if you've not been able to see the whole presentation, to watch again, pick up some of those tips that Brynn's been so gracious to share with us. Share it with others. We would love that. And I really want to encourage you to come back for next week with Sylvia Martini and Mike Carr's following. And our peer group, that's the last thing, our peer group. We have a Facebook, and Brynn, we'd love it if you came on board. You guys are a very important part when it comes to, you know, that whole level of mental well-being. So our private peer group on Facebook, it just allows, it's a really good area and a group of people that share and learn from the people that were within that group. So I encourage you to come and join our Facebook page. Thank you again, Brynn. Thank you, everybody else. Have an awesome weekend. And
looking forward to seeing everybody face to face, because nothing can replace those.
Nothing can replace that, especially as social characters like ourselves, right? So thank you, everybody. Have a wonderful day. Take care.
Thank you, everyone.
Okay, bye-bye.
Bye-bye now.